You may not know this, but gum disease can increase your risk of stroke. It causes a lot of other problems as well. This morning we're sitting down with Dr. Ana Margarita Saenz to talk about relatively new treatment for gum disease. And this is using lasers. It's been around for a while, but a lot of people don't realize that it's out there and available to them. And now, first of all, how prevalent is gum disease in people?
Gum disease, it's about 85% of people in the United States have some type of gum disease. It could be a mild form to the more severe one.
And is gum disease indicative of other problems?
It's a relationship. If you have gum disease, the common factor is inflammation. If you have gum disease, the bacteria that grows under the gum can travel in the bloodstream, and then the toxins are released in other parts of the body. So gum disease, it's related to other diseases, including stroke, diabetes.
Really? And so if you have gum disease, whether it's a mild form or a more serious form, with the mild form, do you need to get professional help right away?
Absolutely, yes. So that's what.
So it doesn't lead to a more serious form?
It can lead to a more serious form, yes. If untreated, you can actually lose your teeth due to periodontal disease.
And the laser treatment they do for gum disease, how does that actually work?
It works with a laser. The laser has a very thin fiber that looks like the...
Because we're showing things right here.
Yes. So you see the gum, the laser going under the gum. It removes the bad tissue, and then it preserves the good tissue, kills the bacteria, and it allows a little space so that we can go ahead and clean all that bacteria and buildup that is on the roots. Once that is done, now what you're seeing is the ultrasonic cleaning instruments, cleaning the roots.
And how do you know if you have gum disease?
Gum disease can be asymptomatic, but most people start developing some type of bleeding or inflammation. And
so if you have bleeding gums, other than, I mean, when you floss sometimes, you get your blood.
Yes, so then when you go to your dentist, the dentist takes some measurements under the gum. If those measurements are deeper than 3, 4, 5 millimeters, then most of the time the dentist will refer you to a periodontist.
And that's what you are, a periodontist. And
that's
how
right.
many periodontists in this area have this kind of a laser that can do this kind of treatment?
I think that about 5.
And it's less invasive than old surgeries, correct?
It's minimally invasive. It just works with local anesthetic. It takes less time than traditional surgery. In the past, we used to have to open a flap and do surgery, bone grafting, sutures. This one doesn't require any cutting or sutures, and patients report minimal or no pain after.
And if it goes unchecked for long enough, I mean, you you said develop diabetes, stroke risk.
Correct.
You could also lose your teeth.
Yes, periodontal disease will not cause diabetes or stroke, but it will make it worse.
Oh, okay. And then you're saying that these treatments can actually, people who have diabetes, it can actually help them. That's a side effect of it.
Absolutely. Research has shown that the treatment of patients with diabetes, the sugar levels are actually lower after the treatment of periodontal disease. And what happens is that the inflammation causes the diabetes to be worse, and then the higher levels of sugar in the blood also feed the bacteria under the gums.
So the first line of defense is making sure you see your dentist and get a thorough examination, because he or she will tell you if you need to go to a periodontist.
That's right.
All right. Well, thanks for coming in. I appreciate that.
Thank you. My pleasure.